$90 to park downtown for one baby.
Wow, wow. Well, I'm glad you're here. All right. Hi, everyone. This is the voice and the face of Dr. Tulu Lokola Bintor, CEO, founder of Living Spring Family Medical Center, where we believe in helping our patients live long and well because we believe the quality of life is just as important as your quantity of life. I am excited today to have the one and the only Dr. Robin Kindred. She's an ObGyn here in Mansfield, Texas. And today we'll be talking about the topic, Doc, my pap smears are normal. What does that mean? Thank you, Dr. Kindred, for coming. It's really,
Thank you
really
for
nice.
having
All right. So, first question people are asking, Doc, who are you and what do you do? Kindly reintroduce yourself.
me. Okay, so I'm Dr. Robin Kindred. I have grown up in the Dallas area, only traveled for training. So I went to undergrad at Howard in DC, went to medical school in St. Louis, and then did my residency in Chicago. And of course, I came back home. As an OBGYN, I really focus on women's health and how I can help them to live a more full life with full autonomy. So in my practice, we do a lot of education on how to maintain your health and improve it. And then, of course, we talk about topics more specific to sexual health and, including pap smears.
Awesome, awesome. I love what you do, Doc, and thank you for doing what you do. Now, those who are wondering are like, how did you decide on ObGyn? So why do you do what you do?
So I have a real passion for educating women and making sure that they sort of have, because I feel like they're the base of the home, and I really want to educate them and help them to live a very full life. And also, I hate dealing with men's health because they don't listen.
Touche.
Right.
And once you can pull the woman in, usually you can get the whole. And you're right. They're
I can
the
get the entire family in. We can improve the health of everyone, and we can deal with like a huge health range. So I've seen people that were freshmen, sophomores in high school, and now I see them graduating from college. Like I enjoy that range of health, and I enjoy that a lot of what I do is health maintenance and improvement.
awesome, 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 awesome. All right, let's get right to it. Pap smear. What
Yes.
is that in simple terms? What is a pap smear?
So a Pap smear is a test for cervical cancers and precancers. Usually we do those every 3 to 5 years. Since we have been doing these tests, we've significantly reduced the incidence of cervical cancers. So the
Mm,
point of these tests is to make sure we catch any changes in your cervix before it can become a cancer.
awesome, awesome. So it's preventive. And
Yeah,
it's preventive. And sometimes, and I wanted you to kind of touch on this a little bit. People assume that doing a pap smear is when you get a pelvic exam.
it is not. Those are two different things. The pelvic exam is when you look at the cervix and you do the bimanual exam to feel the size and shape of the uterus and ovaries. The Pap smear is the specific test for cervical cancers and precancers.
Okay. Awesome. Awesome. So very different. Just because you had a pelvic exam does not necessarily mean that you had a pap smear. And a
And I
pap
tell
smear is very
everyone, if you have not received the results, then it did not happen.
awesome. That's a good one. That's a good one. If you didn't get the results, then it didn't happen. All
Right.
right. So who should get one? We know it's for women, but who should get one? Who should get a pap smear?
So every person starting at the age of 21, especially if they're sexually active, in your 20s, they're usually done every 3 years, and that's just a plain Pap test. After the age of 30, it can spread out to every 5 years, but we also include an HPV test with that.
Okay.
HPV is the virus that can cause changes in the cervix, such as cervical cancers and also genital warts.
Okay. All right. Very good to know. Now, I've had people complain like, "Oh my goodness, I've never had a pap smear. I don't want to have one." And the hiccup number one is it looks painful. Is there a way to prepare for a pap smear so it's not painful? Or what would you say to that question?
I would say that it may be uncomfortable. It is, it seems invasive. I don't enjoy going to get my pap smears, but I
Okay.
do my pelvic every year. But really, it just feels like pressure. It does not feel painful. So it shouldn't be painful, but it is weird.
That's a good one. It is weird. It's
Right.
invasive. There's no way around it.
Right. But
Um,
I can change that. I mean, we chop it up for a little bit before, but at the end of the thing, it always ends the same. And I feel the same way when I do it.
we can relate to how it feels. And I typically say this: the more someone relaxes, almost like you're about to pee on yourself a little bit when you relax, the easier it is.
Yes.
But it is what it is. It's more uncomfortable than it is painful.
Yes.
So still encouraged to do it. All right. Hiccup number 2. I didn't shave, so I'm not ready. I get that a lot.
Oh, my friend, I do not care at all. Words cannot express how little I care about the shaving or the waxing or the any of it. I don't care about any of it. I don't care if your legs are ashy. I do not care.
You know what's so interesting? Oh, hi Tiffany, thanks for joining.
Hello.
I like it's so interesting the things that our patients get bogged down about, like, oh, my legs, my feet. We're like, we're not even paying attention to that. So for those who are watching, who watch this live and the replay, we don't. It's not. It doesn't matter. Okay. We
At
can find
all.
a way. we can find.
Who among us hasn't gone to the doctor and taken off your pants and noticed that you are very ashy? It's okay.
It is okay. Still a very important test. That should not be a deterrent, and that should not be a hiccup to doing your test. All right. Now let's get down to it. As far as
I don't want to be a deterrent. If you are on your period, unless you are having a very heavy flow, please come. Because what happens is you'll reschedule, and we'll reschedule you 4 weeks out from when you are previously scheduled, and you'll be on your period again.
That is a very, very, very good point. So Pap smears can be done even with your period, unless it's super, super heavy. We can find the way to where we need to. All right. So that shouldn't be. Otherwise, it becomes something that gives you more and more of a monthly excuse to not do it. And these are important to do. All right. So now let's get right to it. What does it mean if I have an abnormal pap? So the first thing that comes, because we're testing for cervical cancer, and obviously, these are medical suggestions. We definitely encourage you to have a visit with your gynecologist to go over your Pap smear results, so you can get individualized care. But the biggest scare is, oh my goodness, my Pap smears are normal. They have cancer. What would you say? What does it mean to have an abnormal Pap?
So, for the Pap test, it's extraordinarily unlikely that you have a cervical cancer on your Pap. Remember, the first part of this is to test for cervical precancers or abnormalities in the cell. So there are sort of 3 main abnormalities that we see. So the first is ascus, or atypical cells of unknown significance. Those are generally mild and will self-regress with time, but we will do some testing to make sure that it is fairly normal. There are low-grade lesions, and then there are high-grade lesions. So ascus, paps, and low-grade lesions, we still do a follow-up exam on, but none of these are cancers. These are just how dysplastic or slightly abnormal the cells are of the cervix, but that does not mean that you have a cancer.
Very, very important. Now, you mentioned the 3 big ones. So it doesn't necessarily mean cancer. They're for the tests that are done. So having an abnormal pap is not equal to cancer automatically.
Absolutely not.
All right, so you talked about the next test, and one of the big ones I tend to have to explain to patients in anticipation of their visit with you is the colposcopy. Can you explain that? It sounds scary, colposcopy. What is it, and could you describe it briefly for our viewers?
So the colposcopy, or the colpo, is basically when I sit you back like a Pap smear, I'll clean your cervix with vinegar solution, and the vinegar solution will make any abnormal area stand out. So the purpose of the colposcopy is to make sure that you don't have any hidden high-grade lesions. So remember, the vast majority of people will never get a cervical cancer. This is one of the major changes in the past 40, 50 years. So we always try to catch people with an abnormality and treat or cure it before it can become a cancer. So no one should ever get cervical cancer when you get regular PAPs, because we should pick up the abnormalities on Pap and colposcopy and treat you before we get to that point.
Awesome, awesome. So prevention, prevention, prevention. That's the biggest emphasis here. Whatever procedure, the Pap smear, the colposcopy, the likelihood of you having cervical cancer is very, very small if you do your routine Pap smears. We address the hiccups. Oh, I'm a period, or hairy, or it seems like it hurts. All of those things are not excuses to getting you a regular checkup. If you had a fancy car, sorry, this may be lost on women, but that's the one that analogy that typically comes to me. If you have a beautiful car, you're not going to wait for it to break down before you take it in to be checked up. You are much, much more valuable than any of the earthly possessions that you have. And so it's important that you take care of the body that you're in. This has been very helpful, very easy to understand. I really, really appreciate you for coming and explaining this. So now our viewers know that there's really no excuse to getting your Pap smears done. Now, people are wondering, I really like this doctor, and I want to come see her. Where can people find you, Doc?
So I'm a part of the Women's Health Specialists of North Texas. There are two offices. There are Waxahachie office and the Mansfield office, and I'm exclusively at the Mansfield office. Okay. And so you can go to our website, whsnt.com, to find out more about me. And you can also call 972-938-3493 to schedule an appointment. I would love to see anyone. So don't worry if you are behind. That's another barrier we're seeing, that if people get 2, 3, 5, 10 years behind on their woman exams, they feel embarrassed to come in. And it's very important to know that I do not care, because at the end of that visit, you'll be all caught up. So just come in.
At the end of that visit.
Yes.
I love it. At the end of that visit, you will be all caught up. Doesn't matter how long you had your Pap smear. So please come in, because your life is very important. Quality and quantity of life. This has been very, very helpful. Awesome. All right. That being said, I don't see anyone who has any questions. So for those who are watching live, thank you for joining. Please share with those who will find this useful. Share it with your mom, your sisters, every woman that you love, because it's important that we take care of ourselves so we can also be able to take care of the people that we love. Okay. All right. Thank you so much, Dr. Kindred, for coming.
No problem. I love being here.
Awesome. All right. So if you or anyone you know is looking for an awesome family physician in the Mansfield area, I am she. And if you're looking for an awesome ObGyn in the area, she's she. Okay. All right. Have a good one.
All right. Thank you.
You're welcome.